Navigating the VA healthcare system shouldn't feel like you're trying to read a map in the dark, right? Welcome to this explainer. Today, we're going to completely demystify some of the specialized VA health benefits you've earned, so you're totally empowered to actually use them. By the time we wrap up, you'll have a crystal clear roadmap for bypassing the usual confusion and tapping straight into the support you deserve. So here's our game plan for today. We'll be covering your urgent care benefits, navigating regional care networks, care for women veterans, understanding fertility and ART, eligibility for IVF services, and wrapping up with taking charge of your care. Let's dive right in. Section 1. Your urgent care benefits. Immediate help for veterans. We've all been there, right? A sudden sprained ankle on a Sunday or a fever that spikes in the middle of the night. You definitely need help, but it's not quite trip to the ER level. This is where your urgent care benefit is an absolute game changer. It extends way beyond the physical walls of a VA hospital. You can literally walk right into local, in-network community clinics in your own neighborhood. It covers the essentials you need in a pinch. Think x-rays to check for fractures, critical lab tests, and even some limited immediate prescriptions to get you comfortable and on your way. But here's the catch. To avoid any nasty out-of-pocket billing surprises later, you've got to follow a specific playbook. Step 1. Double-check that you're actually at an in-network provider. Step 2, and this is where a lot of folks get tripped up, don't just assume the front desk knows why you're there. The second you walk up to the registration desk, clearly and affirmatively state that you are using your VA urgent care benefit. If you don't, they might bill your private insurance, or worse, bill you directly. And finally, step 3, just hang tight while they verify your active eligibility in the VA system before any treatment starts. Moving on to Section 2, navigating regional care networks when you need assistance. Okay, so what happens if the front desk hits a snag? Technology isn't perfect, and sometimes the community clinic system might not show your active eligibility, even when you know for a fact you're covered. If you get stuck at the provider's desk, these numbers are your lifelines. The VA actually splits the country into regions to handle these exact hiccups. If you're out east or in the Midwest, so regions 1, 2, or 3, you'll call the 888 number. For the West Coast and Pacific areas, regions 4 or 5, you'll call the 866 number. Doing this gets you a dedicated rep who can usually bypass the glitch and authorize your care right on the spot. But honestly, the absolute best way to handle a snag is just to prevent it entirely. Before you even leave the house with that sprained ankle, always jump onto the official VA Location Finder tool. Verifying that a clinic is definitively in the contracted network beforehand will save you a massive headache when you're already feeling under the weather. Section 3. Care for women veterans. Privacy, dignity, and sensitivity. The VA definitely recognizes that women veterans are a rapidly growing demographic with unique, specific healthcare needs. Because of that, the system is fundamentally designed to offer comprehensive care that absolutely prioritizes privacy, dignity, and sensitivity. At local facilities, we're talking about a massive breadth of services, from vital screenings and disease prevention to routine gynecology. It also covers the whole spectrum of family planning, including full maternity care, plus targeted mental health support designed specifically for women. And here's a crucial point. If your local VA facility lacks a specialized service you need, you're fully eligible for authorized care out in the community, so there's literally no gap in your treatment. If you want to explore these services further, the VA has a dedicated access line. You can easily call or text 855-VA-WOMEN. That's 855-829-6636. But honestly, your most effective resource is probably your local Women Veterans Program Manager. Think of them as your personal advocate inside the VA system. Reaching out to them directly is the quickest way to cut through the red tape and get a customized roadmap for your specific facility. Now, this brings us to a deeply personal and important question. For a lot of veterans, the physical and unseen tolls of their service extend way beyond their time in uniform, and sometimes that directly impacts their ability to start or grow a family. So what happens then? Section 4. Understanding fertility and ART, specialized family planning. To answer that, we have to look at federal law, which gives the VA specific authority to provide some really advanced fertility benefits. A big piece of this is ART, or Assisted Reproductive Technologies. Basically, ART covers any medical treatments that involve handling eggs, sperm, or embryos outside the body. Whether you're looking to preserve your fertility before an upcoming medical treatment, or you're trying to establish a pregnancy right now, this is a really robust benefit. It includes in vitro fertilization, embryo transfer, freezing gametes for later, and even genetic testing of embryos to help ensure a healthy pregnancy. It's incredibly powerful stuff. Let's move to Section 5, eligibility for IVF services, navigating VA terminology. Because these are highly specialized and, let's face it, costly services. Accessing them means we need to unpack some super specific bureaucratic language. The golden ticket here is SEC, which stands for Service Connected Condition. But it's very specific. To be eligible, you must have an infertility diagnosis that is directly caused by a condition the Veterans Benefits Administration has officially recognized and rated as connected to your military service. Or the infertility can be caused by the medical treatment you're receiving for that officially recognized condition. Establishing this direct, documented legal link between your service and your need for fertility treatments is the absolute foundational requirement for IVF coverage. There are also some pretty strict federal rules around marital status and genetic material that you should know about. Any eligible veteran, whether you're single, unmarried, or married, can receive comprehensive fertility counseling. But under federal law, the VA can only actually pay for the fertility procedures like IVF if you have a lawful spouse. Also, while the VA totally allows you to use donor eggs, donor sperm, or donor embryos during your treatment journey, they can't actually foot the bill for those donor materials. You can absolutely use them, but you'll have to get them at your own expense. If you're embarking on this family planning journey, you really need to arm yourself with the exact policy details. Your ultimate source of truth is VHA Directive 1334. This is the official playbook. It outlines every single rule, counseling protocol, and service limitation regarding IVF for eligible veterans. Don't guess and don't rely on hearsay for something this important. Look up this directive online so you know exactly where you stand and what you're entitled to. Finally, Section 6, Taking Charge of Your Care, Master Resource Guide. We've covered a ton of ground in this explainer today, from finding local urgent clinics for a quick fix to unpacking complex federal fertility laws. I highly recommend taking a quick screenshot or jotting down this master resource list. It puts everything we've talked about into one easy spot. You've got the 1-800-MY-VA-411 number for general VA help, the web address for the urgent care locator, and the 855 VA Women number. Having these locked into your contacts before you actually need them is the best way to seamlessly navigate the whole system. I'll leave you with this final thought. Whether it's getting quick relief for a sprained wrist, accessing sensitive gender-specific care, or embarking on the profound journey of starting a family, these aren't just perks. They are vital healthcare tools that you have rightfully earned through your service and sacrifice. So take a hard look at your current healthcare setup. Are you settling, or are you fully equipped to take charge and utilize these specialized resources to their absolute fullest? Thanks for joining me for this explainer, and take care.